Hello and welcome to another episode of Geared Toward Gear. My name is Sean and I am so glad you're here. It's been a while. Yes, I know. Am I back on YouTube? For those of you who subscribe, yeah, for today, I am. I do have a couple other videos planned, but this is not a full-time return. I'm just doing a video because I really felt like doing it, and I will do that periodically. I have a couple others planned that will come when they come. But today we're here to talk about trauma kits. It is May of 2021, and May is Stop the Bleed month. And based on my kind of background, I thought it would be pertinent to do a video on what I think is the ultimate individual trauma kit. Not individual first aid kit, individual trauma kit. We'll talk about the difference. And I have two here to illustrate one thing right off the bat, and that is, I actually have four of these that are identical. Literally identical, and I'll get these open here in just a minute. I'm a big fan of having continuity and having kits kind of strategically placed where I might need them and having them be exactly the same. When I worked full-time on an ambulance, every ambulance in our entire fleet was organized identically. You could get in any ambulance and know exactly what was going to be where, and that's kind of the philosophy I used with these kits. I will also say that for those that don't want to stay for the duration of the video, towards the end I will have one of these kits open with all the contents laid out. I'll kind of go through them one by one briefly towards the end. So if you want to skip what I think is going to be the interesting stuff in the middle, by all means please do. It's not going to hurt my feelings. I'll also have a contents list in the description, but if you want to stick around, I'd certainly appreciate that. So let's get these guys cracked open. These are both the Vanquest FATPack is what I use for my trauma kits. It's my personal favorite. I've tried, I can't say I've tried them all, but boy have I tried a lot of trauma kits. I like that these can just kind of flay open quickly, and you will see that they are in fact identical in their contents, in their layout. So yes, I'm gonna get one off to the side and we'll get this one mostly zipped back up, and let's start chatting about it. So Stop the Bleed month is a month in which we talk about, yeah, you guessed it, stopping the bleed. It's just, you know, it's a month of awareness on responding to trauma, particularly massive hemorrhaging, and the education that goes along with that. So here is my individual trauma kit. Let's start with the vessel itself. Again, I chose the Vanquest FATPack. This is the 5x8 size. They come in 3 different sizes. The pack you choose really doesn't matter. I personally think this is the best option. However, as long as the contents are squared away, what you put it in is up to you. What really matters for me is how quickly I can access what's inside and how well organized it is. Meaning, if I open this, is everything going to fall to the ground? If you can accomplish that with any other bag, then knock yourself out, right? Get whatever makes you happy. I also want to point out before we crack into it that there's some identification on the front of the kit to note that this is a med bag, medical cross. Should be plainly obvious to anybody that sees this that this is in fact a medical a kit that is medically inclined. So there's that. We also have a few pieces of kit on the outside, so we'll touch on that. Starting on the right hand side, we have a cat tourniquet. This is a Gen 7 cat tourniquet, already staged, ready for use. So make sure that whatever tourniquet you are using, which in my opinion should be a cat tourniquet, is properly staged. On the left hand side, I have a rescue knife. This is the Byrd Rescue 2. I have a full video on this. If you look in my knives playlist, you should find that. It's a fantastic knife. You should go check out that video. It's awesome. And then 2 other things on the left side. I've got a Rescue Me tool, and this is a kind of an extrication tool or an escape tool. It's got a glass breaker and a strap cutter. This is here because I just have a bunch of these. This is, in my opinion, not a requirement on a trauma kit, nor is the CPR face shield. I had a bunch of these left over from a class that I taught, so I put it there. Not a requirement as far as I'm concerned. There are very few use cases related to severe trauma where I would bust out a CPR mask. Having a rescue tool or rescue knife of some type, I think, is important, and certainly a tourniquet is a non-negotiable. So that is it for the outside. So let's crack into this bad boy and see what's going on inside. So you'll note that it opens very quickly, right? So ease of access, storage, compartmentalization, nothing is falling out, everything has its place. That is why I love the FATPack. And when it opens, you know, the bottom obviously kind of folds down, and then the sides kind of fillet out like such. And I think it's just a good design. I'm a big fan. So before we go any further, I'll say something I've said in videos previously, and that is that I am a licensed paramedic here in the state of Texas, the great state of Texas. I've been educated in the use of these items. I have educated others in the use of these items, and I have personally used these items in practice in the field. So take that for what it's worth. I am not the expert on medicine. I am far from it, but I do have some practical education and experience, and some time spent as an educator. So take this as both entertainment, but also ideas on how you may build a trauma kit, but it certainly doesn't take the place of formal training on how to use some of the items that you'll see in here. So what do we got? We got some trauma shears. This is a non-negotiable as far as I'm concerned. You must be able to visualize the injury that you're trying to treat. So being able to remove clothes, shoes, jackets is a must. So we got some trauma shears. We got gloves. There's 2 pairs in total. Here's one. And the only real rule, I guess, as far as gloves are concerned, is make sure they're not black. You really want to be able to write on your gloves to take notes, and you also want to be able to readily identify fluids that are on your gloves, blood certainly being one of them. So a pair of black gloves is just not going to give you the visual contrast nor the ability to take notes. So we got gloves. We have some combat gauze, some hemostatic Z-folded packing gauze is what this is. Moving a bit further to the left, we've got a chest decompression needle, a chest dart, an ARS needle, whatever you prefer to call it. And this is a needle that is used for performing a procedure called a needle thoracostomy, by which you would insert this needle into the thoracic cavity to relieve pressure created by either air or blood in the thoracic cavity. Moving further to the left, we've got a Sharpie marker. We have a flashlight for doing flashlight stuff, and we've got another pair of blue gloves. So that is that. Let me rearrange here a little bit, and we'll kind of organize this stuff and touch on this stuff again at the end, as I mentioned. So for now, we're just kind of getting the stuff out. Down here on this kind of flap, which is the front of the kit, I have 2 items, one being a survival blanket and the other being wound packing gauze. This is not a hemostatic gauze like Quick Clot or Celox or combat gauze. It's just plain gauze designed specifically for wound packing. It is folded kind of in that Z-fold manner. So some more wound packing material. And then moving up to the kind of main compartment up here, we've got a few other pockets. On the left-hand side, we have a nasal pharyngeal airway. This is a common but basic airway adjunct. This is a size 28 French, a very common size. You'll see these in most trauma kits. And what's great about this one is this comes from a company called Combat Medical, and it is pre-lubricated. So the days of having a dry, sterile airway and a little squeeze tube of like KY jelly are behind us. We have mastered the technology of pre-lubricating a nasal airway. So we got that. In this, we'll give you kind of a top-down view here. We've got a couple more pockets here, 4 more items. We have a SWAT-T Tourniquet, which isn't really a tourniquet. We'll talk about that. We have a pressure dressing. This happens to be a North American Rescue mini emergency trauma dressing, 4-inch variety. And lastly, in this last back compartment, we have a combine pad, or an ABD pad, a 5x9 thick piece of gauze is all that is, and a pair of chest seals, Hyfin vented chest seals, the compact size, and you get 2 of those. And that is all she wrote. So let me get this off to the side, zip it up just kind of so you can see the tourniquet, keep that in frame here. And then we'll just kind of lay the rest of the stuff out. I know I promised those of you that didn't want to sit around and listen to me talk would get kind of a money shot at the end of everything. So let's try to do that. Just kind of get everything laid out here as best we can without taking too much time. Is everything in frame? Yep, still looking good. We're doing pretty good on time too. We're only at about 10 minutes. While we're doing this, let's talk about who needs something like this. Why a trauma kit? Well, I'll tell you why a trauma kit. Because trauma happens all the time. And it's not always, gunshot wounds and stabbings and all this stuff. But, car wrecks, accidents happen. So having the tools at your disposal to address some of those things is a good idea. And there's kind of some main things we're trying to address, or I would like to address with a kit like this. One of them is going to be major bleeding. Okay, so major arterial bleeding. We've got a couple things here that can address that. We have a good quality tourniquet. We have hemostatic gauze. We have wound packing gauze, and we have even a pressure dressing and a basic gauze pad. So that's kind of all going to address bleeding. Also addressing airway. We have a nasal airway. We have a chest decompression needle. We have chest seals. And even your kind of moderate wounds, right? You can create a very simple bandage or very kind of light pressure dressing with something like a combine pad in conjunction with the SWAT-T Tourniquet, which I'll just touch on this right now. Can be used as a tourniquet technically, but I wouldn't recommend it. These are primarily, in my opinion, going to be used to hold something else in place. Whether that's your emergency trauma dressing, combine pad, you've packed a wound and you want to hold that all in place, a SWAT-T tourniquet could be used for something like that. And I'll give you one pro tip on SWAT-T tourniquets. They have a number of these little tabs that are perforated where you can open them and kind of tear them. But the easiest way to get into one of these is to grab it with both hands, squeeze, and twist. And it'll break right in the middle, and you'll have access to your SWAT-T tourniquet. So yeah, survival blanket, obviously for putting on to a patient who's maybe suffered severe blood loss and they're having trouble regulating their temperature. It's going to reflect back some of that heat. Really looking at this, there's only one item here that's really kind of not super safe to use if you don't know how to use it, and that's the ARS needle. Everything else is pretty straightforward, basic type stuff that you can learn pretty quickly. Wound packing, though, I do want to touch on real quick, specifically as it relates to these two products and how they can be used in conjunction with one another or in place of one another. So, Combat Gauze, Quick Clot, C-Lox is another brand. It's fun, it looks cool, it's sexy, everybody's heard of it. And then this is just plain gauze, nothing fancy. But let me say this. If you use this properly, it's going to be far more effective than if you use this improperly. Meaning the technique for packing a wound is the most important thing. The second most important thing is if you happen to have the bonus of a hemostatic packing material. So when you pack a wound, there's a very specific technique to how to do it to get the packing material close to the wound and maintain pressure throughout the process. If you don't do that, having hemostatic agents in your gauze isn't really going to do you much good. So just keep that in mind. Just because it says Quick Clot or Combat Gauze and it sounds cool and it looks cool doesn't mean that it's magical. You still have to know what you're doing. So I like having both because Oftentimes the combat gauze or the C-locks, there may just not be enough of it, so you need to kind of go on top of it with some additional gauze, which is where this might come in handy, or just for, you know, some other, you know, wound treatment scenario. So we've then got over here the North American Rescue Mini ETD. This is kind of like an Israeli dressing. It's a pressure dressing. You put it on, you wrap it. It provides that circumferential pressure for those more moderate bleeds that don't require a tourniquet. Nasal Airway. It's an airway. It goes in the nose. Pretty straightforward. There's even some nice pictures on there. There is a right way and a wrong way to do this, and you can cause bleeding and some issues if you do it improperly. So you do need to be trained on how to use something like that. Chest seals, I want to touch on this real quick. So I prefer the compact Hyfin vented chest seals for a couple reasons. One, they're smaller, I should say, than a full size, so it fits nicely in a kit. I prefer the vented chest seals because it creates a one-way valve, so air is allowed to escape, but nothing is going to come in and infiltrate into that thoracic cavity. And you get two of them, right? So entry wound, exit wound. That's assuming, of course, that you're dealing with a gunshot, but there are a number of ways you can get a penetrating chest trauma that does not involve being shot. So just keep that in mind. This is not a treatment for gunshot wounds. It can work for that, but this is a treatment for a penetrating trauma to the chest or to the thoracic cavity. One example I've used in a past video was a mountain biker who took a really, really bad spill and landed on the root of a tree that was protruding out of the ground. Landed on it, kind of on their side, and the root of that tree penetrated into the thoracic cavity of the rider, which was not a good day for him. But just an example of a time where you may see a penetrating chest trauma that wasn't caused by a gun or a knife. So that's pretty much it as far as commentary, I guess. I will say that, you know, there's not a lot of people that wouldn't benefit from something like this, but I think it's particularly useful for anybody out there who may consider yourself a prepared citizen, you know, the type of person that would jump in and help in a given scenario. I think these would work great in a vehicle, certainly, which is where I keep a couple of them. These would, you know, go great in a boat, in a range bag, you know, camping gear, your hunting bag. You know, if you're a hunter, if you work in an office setting, having one of these in your desk would be a kick-ass idea. If you're a teacher, you work in a school, having one of these in your desk drawer would be a kick-ass idea. Even if you have kids who are, you know, in high school age, if they understand these things and they're not afraid of them and they know how to use them properly, having something like this in your backpack would be a great idea. I have taken this exact kit on an airplane before. The only thing I had to take out was the ARS needle and the trauma shears. Took those two things out, and the knife, the folding knife that's on the side. But the majority of this is TSA friendly. So you may not always be able to carry a firearm with you, for example, if you're like me and you like to carry legally, concealed carry a firearm, but you can always carry medical gear on you, or at least have it nearby. So I think it's prudent to do so. What else? I guess that pretty much covers it. You know, of course, with anything like this, you kind of have to make a decision, right, in terms of how comprehensive you want your kit to be, where you're going to draw the line on what's too much, what's too little. Somebody's always going to have a different opinion on maybe something else you should add. You know, someone might say, hey, you need a headlamp, or, you know, you need 2 tourniquets, or you need duct tape, whatever. There's always going to be some feedback, right? And some differences of opinion, and that's fine, right? Not all trauma kits look the same, except mine. They're all identical. But that's why I build these, right? Because there's no pre-built trauma kit for me that's just right. So I had to make my own. everything I've ever found commercially. I found a couple that are pretty good, I'm not going to lie, but they always have they're always missing like one or two key items, or maybe they have too much stuff that's just kind of bullshit that doesn't need to be there, like Band-Aids. Like for me, again, this is not an IFAK. This is not an individual first aid kit. There's no Band-Aids, there's no Tylenol. This is for major trauma, something that you can get to quickly and deploy these items quickly to help somebody else who might be in need. And lastly, I'll just add that, again, there are some basic skills required to be able to use these items. So kind of do that at your discretion, right? We all have to decide what we're willing to do and what we're not willing to do. And you'll often hear things like, well, you know, you can't put a chest decompression needle in a kit if you're not trained to use one. You know, check your local laws, but in most cases, these are readily available online. You can own it, you can carry it, you can store it in your kit. I wouldn't recommend using it if you're not trained, but you kind of have those two schools of thought, right? Like, one school is if you're not trained, don't carry it, just leave it out. The other school of thought is, well, leave it in there, and maybe somebody who's nearby, like myself, for example, does know how to use it. So I'm not here to tell you which one's right or wrong, but that those two dynamics kind of exist. So there it is. There is the, in my opinion, kind of the perfect balanced individual trauma kit in all of its glory. Thank you guys all so much for watching. I really do appreciate it. Feel free to drop a comment down below if you have any questions, comments, or concerns, and I'll see you next time.